Today, we will discuss the evolving role of GLP-1 receptor agonists in people with type 2 diabetes and chronic kidney disease. My name is Ian Boer, and I'm professor of medicine and director of the Kidney Research Institute at the University of Washington in Seattle, Washington. I also practice clinical nephrology at the VA Puget Sound Healthcare System. The guidelines have been evolving along with the state of the evidence that we've seen in this field. You've nicely summarized the benefits and risks of GLP-1 receptor agonists in general and for people with chronic kidney disease. So let's take a look and see how the guidelines have weighed those and put them together. And we'll start with the guideline from the Kidney Disease Improving Global Outcomes, or KDGO group. This is the major international kidney disease guideline writing organization. And this guideline recommends a comprehensive approach to modifying risk factors for cardiovascular disease and kidney disease progression amongst people who have diabetes and chronic kidney disease. That approach is based on a foundation of lifestyle management and self-care, first-line drug therapy with drugs that are proven to improve kidney and cardiovascular outcomes, and layered upon that, additional drugs with heart and kidney protection. So where do GLP-1 receptor agonists fall in that algorithm? Well, for people with type 2 diabetes and chronic kidney disease, KDGO considers a first-line therapy with both metformin and SGLT2 inhibitors as first-line therapy for type 2 diabetes and chronic kidney disease. KDGO further recommends that GLP-1 receptor agonists be added on top of that for people who are not achieving their glycemic goals as a preferred next-line agent, or for people who are unable to take metformin or SGLT2 inhibitors because it's not tolerated, their eGFR is too low, or other reasons. The American Diabetes Association and KDGO partnered last year to come up with a consensus statement on the management of diabetes and chronic kidney disease. The flowchart algorithm that summarizes that consensus document looks a little bit like the pyramid stood on its head. It starts with lifestyle therapy at the top, first-line drug therapy, with SGLT2 inhibitors and metformin for people with type 2 diabetes, RAS inhibitors for people with diabetes and hypertension, statins, of course, and then layered therapy on top, including, you can see in this algorithm box, GLP-1 receptor agonists, if needed to achieve individualized glycemic targets for people with type 2 diabetes and chronic kidney disease. Specifically, the consensus statement created by the American Diabetes Association and KDGO is this: GLP-1 receptor agonist with proven cardiovascular benefit in the cardiovascular out trial is recommended for patients with type 2 diabetes and chronic kidney disease who do not meet their individualized glycemic target with metformin and or an SGLT2 inhibitor, or who are unable to use these drugs. In addition, it's noteworthy that GLP-1 receptor agonists may be further preferentially used in patients who have obesity, type 2 diabetes, and chronic kidney disease to promote intentional weight loss.